How would you briefly describe your project to someone unfamiliar with what you do?
So the Texas Congregate Mill Initiative is a research to practice translational project which is trying to modernize the congregate meal services in the state by improving the well-being, social connection, opportunities for the elderly, for the older Texans.
What is the why behind your project?
So the project was envisioned in 2019. Um, from 2005 to 2019, the number of meals served for the older Texans by the Congregate Meal programs decreased about 66%. But the number of older American Texans increased 2.5 million during this time. And so it presented a compelling problem for the decision makers and the policymakers. We needed to find a solution through innovations thinking.
What has worked well for your project?
So the learning collaborative model has been used as a capacity building tool for this particular project, and it has worked really, really well. So for the program managers at the 16 sites, more than 98% are very satisfied with how the learning collaborative model has helped them to think innovatively about changing the programs. Other than that, the marketing strategies, the community partnerships that have been created through the learning collaborative model by the sites have worked really well. The excellent reason to celebrate at this point is the creation of awareness by the projects. So when we conducted a needs assessment for this project, we understood that all over Texas, the older Americans, about like more than 90% did not really know about the programs. But now, after the implementation of the 16 pilots, in all these communities, the surveys are showing that there is a high awareness created about the programs.
What are some challenges your project faced?
The biggest challenge has been, of course, the pandemic. The pandemic has created design implementation challenges because all the sites were not implementing at the same time. They had to follow pandemic mandates, they had to follow closure rules in their own communities. And then the sites that were doing the dining models were more affected than others because they needed people, they needed their clients to be on site, and they could not have that because of the pandemic.
How did you find appropriate partners/partner organizations?
The Texas Health and Human Services Commission came to our organization, the Public Policy Research Institute at Texas A&M, to design this project, and we had to carefully think about the partners that would work for the project. So we included the Supplemental Nutrition Assistance Program. We thought about selecting carefully the sites who would take part in this project. And we also had to think about like other partners, other community-based partners for the sites. So the learning collaborative model was used to help the sites do marketing and community partnerships with various sectors in their own communities.
What funding sources have you utilized or will you utilize?
Each of the sites have raised funds from private and public sponsors. So they have been able to, we gave them like $10,000 to implement the project, and they have gone beyond that. They took that 10 and created like 70 or 80,000 by raising funds from other public and private sponsors about different aspects of their programs.
How will this project be sustainable once your grant period is done?
The sites or the pilots were set up in a way that they are sustainable. They are low-cost, sustainable projects overall. So some of the implementation practices have been institutionalized by them, and more than 67% have been able to raise more funds to continue, so beyond the grant period. As for the project itself, meaning like from the Public Policy Research Institute aspect, we are taking the successes of the project and the outcomes of the project to different grant funders and trying to seek for more funds in this particular research space.
What stakeholders do you need buy-in from?
We needed to have buy-in from the aging stakeholders in the communities, and the sites were leveraged to create those partnerships to enhance their existing partnerships. We also needed buy-in from the AAAs from all across Texas.
What advice do you have for trying to replicate a similar project?
For anyone trying to replicate the successes of the project, you have to pay attention to what worked well, how and why, and for which target population. And in doing so, you need to pay attention to create partnerships with researchers, with community-based organizations, with aging stakeholders, so that whatever implementation happens with careful attention to its fidelity to the model.
How do I get started?
The very first step should be conducting a needs assessment to understand the gaps, and then to address the gaps, try to develop partnerships and networks of researchers, implementers, aging stakeholders, and then try to leverage the experience that is already there with the nutrition providers to find solutions to the problems.
What do you wish you would have known prior to beginning the project?
I wish like as a project we knew more about the innovations in Texas that have had success in the past. We also, if we knew the high need areas that needed the project more, and what was existing in those high need areas where there were like lower engagement, it would have helped the project.